Benign Paroxysmal Positional Vertigo, or Bppv, is one of the most common causes of vertigo, often linked to displaced calcium carbonate crystals, or canaliths, in the semicircular canals of the inner ear. These canaliths interfere with normal fluid movement in the canals, sending incorrect signals to the brain about head position and motion, which leads to vertigo. Now, let's discuss two effective treatment maneuvers that help reposition these canaliths: the Epley Maneuver and the Semont Maneuver. First, the Epley Maneuver. This is a series of head and body movements designed to move the canaliths from the posterior semicircular canal back to the utricle, where they can no longer cause symptoms. Here's how it works. Start by sitting upright, and then tilt the patient's head to 45 degrees toward the affected ear. Quickly lie them down with the head extended back off the edge of the table. Hold for 30 seconds. Turn their head 90 degrees to the other side, still holding the position for another 30 seconds. Next, roll the patient onto their side so they're looking at the floor again for 30 seconds. Finally, have the patient sit back up slowly. It's important to allow a rest period between movements to ensure the canaliths settle properly. Next, we have the Semont Maneuver, which is faster but just as effective. It involves rapid side-to-side movements. With the patient seated, turn their head 45 degrees away from the affected side. Quickly move them to lie down on the side of the affected ear and hold for 30 seconds. Then, rapidly move them to the opposite side, keeping the head position stable, and hold for another 30 seconds. Finally, return them to a seated position. Both maneuvers aim to reposition the canaliths, relieving vertigo symptoms. Success rates are high, but patients may need to repeat the maneuvers or combine them with vestibular rehabilitation exercises, such as gaze stabilization or balance training. In conclusion, understanding the underlying pathology of Bppv and mastering these treatment techniques is key in managing this common but troublesome condition. Remember, patient education on post-treatment precautions is just as important for long-term success.